محیط کار که میآیند باید چادر نماز بپوشن.
بدون کدام امتیازی از وظیفه اخراج شدن.
مالیات زیادی وضع میشه به کلینیک ها.
This documentary tells a story that has too often been overlooked. It is based on an extensive field study across 20 provinces in Afghanistan, including 100 interviews with women receiving healthcare and 60 interviews with female doctors, nurses, and midwives who serve on the front lines of women's health. This research shows that access to healthcare often depends less on medical need and more on Taliban's and social restrictions, mobility, and the presence of a male guardian. In remote areas, pregnant women are sometimes carried for hours by family members or on animals, and emergency transfers often fail. The mental health crisis is alarming. 88 out of 100 women reported serious symptoms of depression, anxiety, chronic fear, and loss of hope. Young women are especially affected, facing restrictions on movement, loss of education opportunities, and the lack of mental health services. Female healthcare workers, the backbone of the system, face immense challenges: dress codes, mandatory mahram, reduced salaries, constant oversight, and even dismissals without legal rights limit their work and directly reduce women's access to care. This documentary was made to bring their voices to light. Doctors, nurses, and midwives speaking about the obstacles they face every day. Despite years of education, it reveals the human, professional, and structural barriers shaping women's healthcare.
در ولایت بدخشان ولسوالی
In Badakhshan province, especially at the district level, women often become sick when seeking care at hospitals or clinics and face serious challenges in accessing health services. One of the main challenges is the lack of transportation. Long distances to health centers, especially during winter, exacerbate the problem. In many cases, there are few vehicles available, and even when a vehicle is found, roads are often blocked due to heavy snowfall, sometimes for several days. This situation prevents women from receiving timely medical care and can, in some cases, lead to the loss of lives. Another serious challenge is the shortage of doctors in villages. While the number of female patients is high, the availability of female health staff is limited. This shortage often prevents adequate care and prolongs illness. In many cases, patients have to be referred to district hospitals or other centers. Restrictions on women visiting health facilities without a male guardian are another major barrier. Previously, women could access health services independently, but now visiting without a mahram can result in harassment, further limiting access to care. Regarding treatment costs, when patients visit hospitals, they usually receive medication from the hospital itself. Maternal care services are relatively acceptable. Previously, pregnant women received nutritional and health support from clinics from the first to the 9th month of pregnancy. However, at the time of delivery, due to the lack of advanced equipment and facilities, adequate services are often not provided, sometimes resulting in maternal death. The health and mental well-being of women is also concerning. Many women suffer from depression, anxiety, and stress due to their combined burden of household responsibilities and external work. The lack of equipped clinics and professional doctors adds to the anxiety of pregnant women, who may fear of their lives when seeking care. The behavior of health staff is generally acceptable, But the main challenges in the health sector are the lack of advanced equipment, shortage of female staff, and limited health centers. When only one doctor is available, it's impossible to provide care to all patients, creating difficulties for both doctors and patients. Establishing more health centers in each district, increasing the number of health staff, especially female staff, and providing advanced equipment and facilities can bring significant improvements in service delivery and reduce existing challenges.
بیشتر تحت مراقبت جدی باشن.
سه مشکل اساسی نبود امنیت.
In assessing these current situations, three fundamental challenges are clearly evident, each negatively affecting both administrative and social structures. First, the lack of sufficient security has created an environment where trust and stability for regular and professional activities are absent. This situation disrupts workflow and limits opportunities for progress. Second, discriminatory practices such as misogyny, linguistic bias, and aesthetic favoritisms are noticeably present. Those behaviors undermine the principle of equality and social justice, preventing individuals from being evaluated based on merit and capability. Third, the principle of meritocracy in appointments and transfers is not properly applied. Individuals with professional expertise, experience, and valid credentials are often overlooked. Conversely, those lacking the necessary skills or qualifications are sometimes placed in key positions due to factors such as previous affiliations, special considerations, or support for certain agendas. This practice results in qualified individuals or being displaced and unqualified persons occupying the critical roles. The continuation of such practices could have widespread negative effect on administrative efficiency, public trust, and overall development, highlighting the urgent need for attention and meaningful reform.
جای یک فرد شایسته رو میگیره و جای به جای میشه.
قابل ها به دکترهای زیادی که
A large number of midwives and female doctors who had been formally recruited through official examinations processes and had served for approximately 8 years have unfortunately been dismissed from their positions without any consideration of entitlements or legal rights. These health workers had dedicated years of service in the healthcare sector with commitment and experience. However, at the time of their dismissal, no benefits, post-service entitlements, or legal compensations were provided to them. As a result, their professional and legal rights were ignored and taken away.
شغل از اینا گرفته شد. دکترهای عزیز ما و قابله های عزیز ما در شهر هرات
In Herat province, female healthcare workers, particularly midwives and doctors, face extensive economic and professional challenges. One of the most significant issues is the requirement of a mahram, male guardian, which directly impact their professional activities. Midwives working in both public and private clinics have experienced significant reductions in their salaries. Income level have dropped sharply, and they are even prohibited from receiving any kind of fee or token of appreciation from patients. Additionally, they are required to strictly adhere to designated working hours, and any absence, regardless of personal or family circumstances, can put them at risk of dismissal. In some cases, reduced salaries combined with high living expenses have forced several midwives and doctors to leave their positions. Workplace restrictions also pose major challenges. Female staff are required to wear a prayer veil while at work, and at certain times, wearing a full burqa was enforced. Women working in healthcare who must travel long distances are required to be accompanied by a mahram at all times. Without a mahram, they cannot be employed, continue their duties, or access to work areas. Collectively, these limitations and challenges create several obstacles for female healthcare workers in Herat, negatively affecting both the quality of service and women's access to healthcare.
امتیاز خاص دیگه هم ندارم متاسفانه. زیاد میان به کلینیکا.
Supervisory authorities and rebel maruf offices or relevant departments regularly visit clinics to monitor patient numbers, services provided, and medical examinations. In many cases, clinic managers and directors face intense pressure, with repeated complaints and criticisms being raised. Common criticisms include claims that clinic lacks adequate facilities, the working environment is unsuitable, or the healthcare services are being overprovided. As a result of these pressures, some sections of certain clinics have been shut down, and several staff members have lost their positions. This situation has also led some clinic managers to transfer their private clinics to other or to completely halt and close their operations.
دیگه مشکلات هست بله.
I want to share my thoughts about the challenges faced by female healthcare workers, whether they're doctors, midwives, nurses, or other staff working in the medical field. One major issue is access to remote areas. In many distant provinces, women are not allowed to work without a male guardian. Even when permission is granted, reaching these areas is very difficult. Traveling long distances and working without a mahram makes their work extremely challenging. Another important issue is the hijab. In our Islamic country, wearing the hijab is mandatory. However, the main challenge is that the Taliban do not accept the Islamic hijab as it is. They enforce an extreme version according to their own ideology. Female healthcare workers, including midwives, nurses, and doctors, are required to wear the burqa at all times and follow this strict rule, even in remote provinces where they work. Women also face cultural and societal barriers, which are worsened by harassment and restriction imposed by the Taliban. In fact, the Taliban themselves play a role in harassing female healthcare staff, including sexual harassment. In many communities, women are not recognized as capable of performing professional duties, and they're expected to stay at home. Yet, many women have no male guardians or household heads, and are forced to work outside to provide for their children, siblings, or parents. Economic difficulties are also severe. The salaries that female doctors, nurses, and midwives earn are low, and their hard work is often not recognized. Many women risk their lives to save others, but receive very little support in return.
More than just numbers, this story reflects the dignity, rights, and access of women in Afghanistan. Women's health is not only a medical issue, it is a measure of the health of an entire society.